Morning, Scott County. May I just say that Scott County's never looked so good. We're going to call the special meeting of the Scott County Board of Commissioners for March 31st to order. And before we do the pledge, we're going to do a roll call. I'm looking to Tracy because we are in attendance here. The three of us are here at the desk. And we have two coming in via Skype, and the room has no more than 10 people. And we are well, Doc, would you say we're well social distance here? All right, we're getting it done. So Tracy, if you could take roll call for attendance, please.
Sure. Commissioner Weckman-Brecky? Here. Commissioner Wolf?
Here.
Commissioner Beard?
Here.
Commissioner Beer?
Here.
And Commissioner Ulrich?
Here.
All right, we are here and in attendance. Let's join for the pledge. Pledge allegiance to the flag
of the United States of America
and to the republic for which it stands, one nation, under God,
indivisible, with liberty and justice for all.
Thank you very much. Appreciate that. Item number 2 is amendments to the agenda. I'm not seeing any new amendments looking down to my left. So the agenda will stand as distributed. Item 3, approved minutes of the March 17th, 2020 County Board meeting. Are there any changes, additions, deletions, any?
Mr. Chair, I will move approval of those said minutes.
We have a motion?
Second?
And a second. Any discussion? All in favor? Say aye. Oh, sorry, I almost got ahead of myself. We got to roll call this too.
Sure. Commissioner Weckman-Brecky?
Aye.
Commissioner Wolf?
Aye.
Commissioner Beard?
Aye.
Commissioner Beer?
Aye.
And Commissioner Ulrich?
Aye.
Minutes are approved. Item number 4, recognition of interested citizens. Always a highlight. Give people an opportunity to come and tell us whatever they think. I'm not seeing any motion or movement, so we will go beyond item number 4. And we're going to move to item number 5.1, and we're going to receive a coronavirus COVID-19 update. Coronavirus. I haven't said that about 1,000 times. Lisa, hello, good morning.
Good morning, Commissioner Beer and commissioners. Sorry, you're sterilizing.
Yes, well, that's the age we're in.
So last time I was here was March 2nd, if you recall. And we talked about some updates for coronavirus, and today I'm going to just do kind of a situational update. This isn't showing very well. F11. Wait, I haven't sterilized F11. There we go. Well, a little bit hard to see.
They're going by pretty fast.
Yeah. So last time I was here, March 2nd, that was just a few weeks ago. And if you recall, it's hard to see that top number there, but on March 2nd, worldwide, we had about 87,000 cases of coronavirus, with 2,977 deaths. Today, it looks like, from what I can see, we have about 803,000 cases. I'm unfortunately unable to see the deaths on here. It worked yesterday just fine, so I'm not sure why, but there's a lot. At that time, we had only 16 confirmed cases in the U.S., and today we are the highest in the world at 164,719 cases, and these are tested cases. These do not include those that are presumptive positive. See if I can find out how many deaths we have here. I'm going to try and bring this up. New York. Why isn't this showing, Scott?
I don't know if we can move up or not. Must be just the resolution for the presentation.
Sorry, I can't tell you how many deaths we have. Most of the cases and the deaths, about a third to a half, depending on what day you look at, are in New York right now. Sorry, I'm having some. Trying to get it back to the PowerPoint now.
Oh, F11 again.
See, we are all in this together. We are
It
all in this
works
together.
every time,
Whatever it
except
is.
for right now.
I know, that's how it goes.
I did hit escape. Then I hit F11. How about Alt F11?
There was something up here, if you could maybe minimize that.
There we go, thank you. So that's a look at the US right now. It's in every single state. The darker the color, the more cases. The orangey in the middle, where it's kind of light, that's 51 to 100 cases. And the darkest color you see here, these states are 5,001 or more. There is some good news. I was trying to share some good news with you today. It was a little difficult finding some, unfortunately, but the good news is preliminary information out of New York is saying that even though the cases are going up, it's getting slower. It's slowing down. Just a little while ago, when it was previously doubling every 2 days, started doubling only every 3 days, then every 4 days, and now they're at about every 6 days it's doubling. So they're definitely seeing a slowdown. They've also tested over 186,000 people, which is helpful. So some of those numbers are fairly accurate. In Minnesota, our numbers are going up, but not as rapidly. This was as of yesterday at 11 o'clock. They do an upload every day. So right now we're looking at 576 positive tested cases, and I'm gonna just reiterate that a couple of times. We have 48 counties in Minnesota that have positive cases. So these are cases that are confirmed with testing. They are not testing a lot of people. Right now, the protocol is test only those who are actually hospitalized and healthcare workers. So just the tip of the iceberg. So we know that there's a lot more. They have done 18,822 cases as of yesterday, and we've also had 10 deaths. The information I have on at least the first 5 have been individuals in their late 80s. I did not get, we actually increased just the other day. I have not received any information on those other deaths yet, and I haven't looked in the media. But so far, we've had the ones that have been deceased are in their 80s, and now they're also testing a few people that are already deceased to see if they were also positive for coronavirus. So I'm not sure, but I think a couple of those numbers are. We've had 92 hospitalizations in total. Currently, there are 56 people, well, as of yesterday, 56 people in the hospital and 24 are in ICU. Important to look at those numbers, because right now, about 50% of those hospitalized are in ICU. 260 people are no longer needing to be isolated. So these are people that have recovered, have gone beyond the length of time needed, and are no longer contagious. So
just a clarification, is that where they test twice? They have to have 2 negative tests in order to be...
I'd have to confirm that. That's what they were saying before, but I suspect, and I will confirm this, that these are people that have been sick and are beyond, haven't been symptomatic and haven't had a fever for at least 3 days.
Because we're still learning all about this stuff, right? So...
Yep. The original requirement was those negative tests, but I suspect, and I don't know if you know, Dr. Wilcox, but with the shortage of testing,
Right.
they're probably not requiring that anymore. So what they are saying now, particularly for people with home isolation, you've got to wait a full 7 days and then 3 days after your fever. So I suspect those are not the ones that are being tested or not being tested.
So do we know, I mean, so much of this changes so fast.
Yep.
We get one piece, even us, we get a piece of information, we act on it, and we just acted on it and it's already 4 hours old. It just moves so fast. So some of these questions may not have answers, but do we know enough about this thing yet that once you've fully recovered, I'm using air quotes, just whatever that means, like you're no risk of being contagious, or do we still not?
Commissioner Beer, that's a very good question. They're still looking at that.
Okay.
I was just reading an article yesterday that preliminary results in testing in mice are showing some immunity. They're working on that.
Yeah.
But, and I don't know if you have anything to add, Dr. Wilcox?
I could mention to you some of the newer tests coming out now. When you do a blood test, it's called the ELISA test. Within 15 minutes can tell you, number one, if you've got the disease. They do a study called IgM, and they have another version of that called bodies that have fought off that virus.
Right.
Now, most often, if you have high quantities of that, that means you're immune for that. The question is, how long does it last? And these viruses mutate a lot.
Mm-hmm.
So they may head it off this time, but then in a year, there's
Right.
a new version of it.
Yep.
Thank you.
We're gonna get through this one first, though, right? Let's get through this one first, yes. Thank you.
So currently, cases that we know of, we have 10 cases in Scott County that have been tested and are positive. I know personally that there's a lot more.
And on that note, we're getting that information from MDH, Minnesota Department of Health. It says, hey, you've got 10 in your county.
Yep,
That's what they're telling us.
yep, we get up,
So,
oh, sorry.
there's privacy. We don't necessarily know, and even if we did, that's not something you can share, right?
The locations of the patients is confidential, and it's also misleading, because we don't only have 10
Right,
in the
right.
county, we have a lot more than that, because people can't get tested. But
Right.
that is private, it's considered currently, by the Minnesota Department of Health, private health information.
Right. Yeah, yeah.
Mr. Chair, thank you. Lisa, early on our first couple of cases, I think we as the county even said Prior Lake. And then after that, no longer had a town affiliation. Can you speak to that at all? Because some people are asking why we could say that in the beginning and we can't now.
That information should not have been shared. Commissioner Brecky, Minnesota Department of Health has made it very clear that we are not to share the location or even the city.
Okay.
We don't receive the patient name, we don't receive the address, we don't receive any of that information from the Department of Health at all. Originally, though, we did have that information shared with us that it was Prior Lake. That was the very first case.
And that was the extent of the information we received?
Correct.
Okay, thank you.
We usually find out if we receive information if they're hospitalized, if they have had international travel, but at this point, there's local transmission, so they're not really focusing on that anymore. And we also receive information related to whether they're a healthcare worker. And most of them are hospitalized. It's really one or the other. They're either hospitalized or they're a healthcare worker, because that's the only people they're being tested right now. So thank you for your question. I apologize if this is a little fuzzy. I took it off of the governor's media. This is some of the modeling. So we're really trying to figure out how many cases we're going to get here. What is the modeling that we're doing? And this is what the governor released the other day. This is with some of the containment strategies that we're using, which currently is sheltering in place. So in his press conference the other day, he said, we believe approximately 50% of the population in Minnesota is going to get this. That's about 2.4 million people.
Can I ask you to pause just 1 second?
Certainly.
I'm having an issue with the streaming, and I don't think the recording is working.
Okay.
So if we could maybe recess?
Recess. We are in recess.
Excellent. I don't have to.
It was more of just a
And
personal
it would be,
curiosity.
Okay, are we ready?
should I just pick it up?
All right.
Great, thank you.
We are back in session from a little technical difficulty, so thank you for your patience with that. All right, back to you, Lisa.
Thank you. So the strategy, if 2.4 million people get it, they're estimating that approximately 60,000 people are going to need to be hospitalized. And approximately, if you look at the little chart there, that's the blue line. The little green line is the number of ICU demands. Well, we don't have even that amount in the metro. So what the strategy is now, according to their modeling, is accepting these numbers but trying to spread it out instead of happening all at once. The containment, the staying at home orders is really to spread it out. So hopefully between 100 and 200 days, that's when we'll have that surge on the healthcare system. So it's really to relieve the burden on the healthcare system so we can actually work with that and get people the services they need.
All right, another question on this, sorry, not sorry, but this modeling data, this is our own, meaning the state data,
State data.
as opposed to, so this should hopefully, I mean, it's modeling, I get it, but using our state data and the best modeling trends that we think we have for us, for our state, not no one else.
Yes, correct, Commissioner Beer. We are at a local level trying to get more of county-based numbers. Those aren't available, but we're going to be doing, and I'll talk a little bit about that as well, of what we're doing to try and get a little bit better numbers on a local level, what that means for us. So we are working on some of our own containment strategies. In the area of isolation and quarantine, we are currently setting up a location in the county for those who may not be able to self-isolate or quarantine at home. So these are people who have been told that they have coronavirus and maybe they live in an apartment with 1 bedroom and 4 kids. And so they are not able to separate themselves. We have been, have been setting up to provide needed supplies for those who are in quarantine and isolation, either at home or at our facility. That would include masks, thermometers, which are critically important and completely unavailable right now because they need to be taking their daily temperatures, and that will also help us know when they're out of isolation. Disinfectant, if they're sharing a bathroom with a family of 4, how do you clean afterwards? And you know, and you can't get those hardly anywhere.
True.
And looking at,
Mr. Chair and Lisa, I have a question. So we're setting up this protocol, these supplies, all this. How does the connection happen between these individuals and Scott County Public Health for us to provide this?
good question, thank you, Commissioner Brecky. We have a, not a hotline, but we have an intake line that we normally use when we get referrals. So we will be pushing this out to our community partners. I'm receiving personal calls on my cell phone already. But this is an intake line that Public Health will be manning. We are answering questions for the public a lot, answering questions about length of time, and fielding. I've set up a questionnaire asking these very specific questions. Do you have communication ability? Do you have ability to stay away from others in your home? So we do have a questionnaire set up. We have not had anybody yet ask for any type of housing related to this. We also, MDH in their assessment, in their 2-hour assessment, finds out what essential services they may need, and we are receiving those from MDH. So there's 2.
Question. This is Commissioner Beard. I have a question about that.
Yes, Commissioner Beard.
There. Thank you. Back to more fundamental than the question Commissioner Brecky just asked. Just a moment ago, we said we're not allowed to know even what city the infected people live in. Does somebody somewhere notify Scott County Public Health who the people are specifically, or does that privacy prohibition block even that, so this becomes then a voluntary disclosure by those who are infected? In other words, how do we know which home to quarantine and which one needs our specific attention to prevent the public spread?
Thank you.
Me?
Yes, I am. So if they do need essential supplies, they agree to disclose their address to.
No. How do we know who needs the supplies? Who tells us who the people that need quarantined are? Do we ever know that as a public obligation, or is this all a voluntary disclosure?
So Commissioner Beard, I think this is one of the processes that we are working through today. When are these demanded that we have to step in and help? And then what is the level that we're going to go to on these different cases? Some of it would be voluntary, and then there's some that might be ordered to do it, and at which different levels those happen, I think we're still trying to work through as part of our process.
Okay, I may not be making the question clear enough, but proceed with your, the discussion about what kind of supplies and all that. That's an operational question. I'm talking about the foundational privacy question, where we were just kind of reprimanded for even revealing that we had an infection in Prior Lake, for goodness sakes. But now all of a sudden somebody somewhere needs to know a specific address and a specific person. When does that happen and who has the authority to disclose that?
Right.
That's my question.
Yes.
But perhaps it'll be covered as the presentation continues.
I don't think I have a slide on that, but just to reiterate, MDH, Minnesota Department of Health, in their interview process with them, if they need a supply, they ask them specifically, are you okay with us sharing that information with the local health department so they can get you these essential services? And in ours, in our screening process as well, if they call us, we are also getting a release from them
Yes.
to make sure that they know that we are going to have to share either their address at least with somebody, either a Scott County employee or one of our partners, to get them that supply. So they have to verbally agree to allow us to release that information. Does that answer your
Okay,
question?
That gets at the heart of the question.
that's
It's
what I
still, it is a voluntary disclosure then by the
Correct.
infected person is what I'm understanding.
Correct.
Mr.
I'm
Chair,
not making any judgment call, I'm trying to understand how this happens, because
Right.
when this is over, we may want to have a discussion about infectious diseases and the spread in the community and who has a right to know what, but that's beyond the purposes of the meeting this morning.
Well, and Commissioner Beard, this is Leslie. I think the other thing is remember, our staff provide essential private information through Health and Human Services on a lot of levels, and they would be bound by those same types of confidentialities on how they provide those services.
Correct.
Sure, okay. Thank you for entertaining the question, I appreciate it.
Good clarification. We got another question.
yeah, Mr. Chair, Lisa, and I know the intake line's already operating, and because it has to for other things, when will we be, like you said, pushing that out, publicizing it? I think Carver started doing that a couple days ago. Because I assume that will alleviate some pressure on some of our other lines, dispatch for sure.
Our plan was not to widely publicize that because that will probably overwhelm our system. We are pushing people to the Minnesota Department of Health just for general coronavirus questions. We will be sharing that information. We have on Thursday, I have a listening session in partnership with Shakopee Diversity Alliance with the Latino community, and we'll be sharing that information there. But our goal is also to share it out with our partners, CAP Agency, the WIC program, other local, the faith-based organizations for people who have questions, because they're getting questions. I'm receiving calls from pastors and from local community-based organizations.
Commissioner Brecky, Chairman Beer, I think this is one of the things we're really trying to work through, is at what level do we provide some of these things at the county, and what is our requirement and our obligation under state statute and the law? Some of these things, such as masks, if we give them 4 or 5 masks, does it really cover and help it all, versus we have such a shortage for our own law enforcement and for our own staff. So part of this is trying to work through that procedure at what is our obligation in providing some of these types of equipments and needs.
And thank you for bringing that up, Leslie. There is a state statute that requires, if people are put in quarantine or isolation by the Commissioner of Health, that essential services are provided to them. I'm waiting still for clarification from the Department of Health. They're working through these at a statewide level as well. Are people, is shelter in place considered an order by, are you ordered into quarantine? Are you ordered into isolation? To try and identify our level of a requirement there. But the bottom line is, if people don't have food at home, they're gonna go to the store if they're sick or not, and we don't want them to do that. If they don't have money to buy food, they're gonna go to work. So these are critical containment strategies at this point to try and stop the spread of this. The other thing that we're working on both a regional level and a local level, is trying to measure transmission in the county. We have 10 cases. Well, I personally spoke with at least 4 people this past weekend who have been told that they have coronavirus. One actually on Friday night went to the hospital and was turned away, had all of the symptoms, and they just told him to go isolate at home. They can't get tested. So already that's almost half of the cases, additional half of the cases. So we know that we have a lot more than 10 in our county. And we're going to be trying to measure that both on a regional level as well as in the county. The other thing that we're working on is this local support. I was going to be working on a survey to try and find out what the needs of the community are, but I have spoken with quite a few key leaders in the community, particularly in the Latino community, and they've all said the same thing. We need information. We need simple infographics, if even just what it is. What are the symptoms? What does home quarantine mean? What does isolation mean? When we're in isolation, what can we do? How do we clean? How do we take care of sick people when they're in their home? So they need information in their languages. We're working on that. They need food resources. Esperanza has stepped up their community food giveaway. Last Saturday, they expected 50 families. They got 175. I think she told me they ran out of some things at 11:26. They started at 11 o'clock. 80% of those families were not Latino. I want to stress that. So it's everybody. So they're increasing their food giveaways. They're partnering with Cub Foods, who has been very generous to provide donations. They're working with Unidos Minnesota for deliveries. So if someone can't get out of their house because they're sick or under quarantine, they're arranging delivery of food to their homes. We are working with them to talk about, or to get them an additional freezer. This was approved by the Department of Health to purchase another freezer for them using SHIP money. So we're trying to access resources wherever we can. And they're also looking right now, most of the meat that they're getting is pork. And so we are going to be getting some chicken as well, so we can help the Somali community as well, because they don't eat pork. Housing has been a huge need for them. This has been expressed by many community members that I've talked to. It's causing a lot of anxiety for our community, particularly our undocumented residents. They do not qualify for stimulus money. Even in a mixed status home, so you have one who's undocumented and the other one is a legal American citizen, they do not qualify. Their children do not qualify. So they're not getting stimulus money, they're not getting unemployment, they are out of work. There is a rental program right now where you can't get evicted, but I must have heard at least 3 times, if I can't pay this month's rent today, how am I going to pay 2 months' rent in next time? So really quite a lot of stress for them. My next slide, I'm working on community impacts. This keeps freezing. Impacts, and I've got some quotes from some of the community members that I've been talking to, and this has been echoed. There's no place we can go if one of us gets sick. So they can't go to the clinic, they're not taking them at the clinic, they can't get tested, they don't really know what to do. And again, this is the quote I mentioned, if we don't have money to pay today, we're not going to have it tomorrow. And we're looking at what are the jobs that these individuals are that are currently out of work. And we're seeing a lot from the service industries, the restaurants, construction, hair, nails, all of those service type industries positions, they're all out of work. And if they're sick, they're also out of work. So regardless of how you feel, but whether undocumented residents should get stimulus money, from a public health perspective, if they don't have money and they need to feed their family and pay their rent, they're going to go to work, whether they're sick, whether they're exposed. So we really need to provide some assistance. This one last quote actually hit me quite hard, because I do have a child who is sick, and I don't know if it's coronavirus, but he's quite ill, and he doesn't live with me. But I can't help him. And this is from someone in the community. What has been the hardest so far? When you can't hug your daughter when she's crying, telling you she can't stop thinking she's going to die alone. So this is what our community is going through right now, and I wanted to share that with you. I'm going to turn it over to Scott, who's going to talk a little bit about what they're doing on the emergency operation level. Thank you.
Thank you. Appreciate the update.
Oh, sorry.
It's okay. You can just maximize it.
There you go. I wiped it off.
Good morning, Commissioners.
Good morning.
So I am going to avoid touching stuff here. There. I'm just going to kind of highlight and take over from what we talked about last, or 2 weeks ago, and 2 weeks before that, and just kind of give you kind of a progress report for what the county's response, county's actions to combat COVID-19, and how we've adapted to the new normal that we're facing here for, could be, for some time. I really want to highlight that the actions that have been taken are truly a county-wide collaboration. If you look at our emergency operations staff and our EOC operation, we've got people from every division in the county who have come together to work through this process. We're actually staffed up in our EOC. We have 3 teams that are set up, and we're rotating through different days of the week. So they're up for 3 days and then on to the next team. And we have those teams set up so that they don't cross. So when our red team's on, when they're on, and then we've actually had a lot of them teleworking as much as possible to keep them distance. But when they're off, then they're off that role and they're back in their normal departments. And then our white team comes on, and they're on for the next 3 days, and then they're off. And we're doing this so that if we do have an impact to any one of those teams of our EOC operation, we've got 2 other teams that are fully functional and have been trained up and are operating in that role and can continue to operate as we move forward. So we built in a lot of redundancy just within that process. But I truly want to highlight, like I said, this is far-reaching within our organization. There's representation from all the different divisions in the county and departments in the county that are a part of this response effort. So it's truly bringing out the best in our staff and working collaboratively towards a solution here. Some of the things we've done, as you've seen, we continue to implement social distancing measures. Throughout the process of this, throughout the county, we've looked at how the new normal comes, how we avoid having employees in direct contact with people, how we make sure we continue with sanitizing spaces, and looking at how we can best protect our employees and best protect the citizens so we continue to do business as we move forward. A lot of actions have been taken, as is evident in the boardroom today and throughout our organization. Excuse me. One of the really key fundamental things that's been done in the last couple weeks is we've enacted our continuity of operations plan for the county. This has taken a lot of work to change and operationalize that plan. So what this is a plan for how each of our county divisions continue to operate. Things like how we continue to deliver services in an impacted world where we don't have, traditionally a COOP plan is based on facilities being impacted or bad weather. But we've activated that plan and we're implementing solutions which includes the use of teleworking, alternate scheduled, so people aren't overlapping in this case, and looking at other options. People are sometimes working in areas like our libraries where if an employee doesn't have internet access at home, but they're able to get into a library, they're able to continue to work without the county having to buy additional resources like wireless data for them. So there's a lot of alternatives that have been implemented to allow us to continue doing the business of the county. It looks different, but it's continuing. Some of the impacts are we are using more drop boxes now when there's not data that's sensitive that needs to be protected. We've opened the door for people to bring things in and drop them off so there's not that person-to-person contact. Libraries are working on a solution where we're getting them bags, so as people order resources from the library, the person working can put that in a bag and then be able to pass that off to the customer without having that person-to-person contact. So the county's really shifting and looking to the new normal of how we do business to protect ourselves and continue to protect the public. I talked about the continuity of operations plan. We've also really been working diligently under the leadership of Leslie to operationalize our service plans, which we're going to be talking about here, I think in the next agenda item or next 2 agenda items. So these are the plans where it really defines how business units are going to then implement this new normal, how we protect ourselves and continue to deliver services. I said this 2 weeks ago and I will reiterate it. Part of this process has been identifying how we keep business going. The county's not shutting down. It will look a little bit different, but we will continue even if we have a massive amount of employee illness. We will continue to deliver critical services. The division directors and staff have come together and identified 22 services that are identified as critical that no matter what happens, we're going to continue to make these things work. It's going to look a little different, but we're going to make them work. 911 is going to continue to operate. Emergency response is going to continue to operate. Adult child protection will continue to operate. We're still going to track our sex offenders that are high risk. We're going to continue to pay our bills that have to be paid without jeopardizing the county's interests. Our mental health services for crisis response are going to continue. So the county's identified these critical functions that we need to continue to make work. 'Cause it's even at a point of crisis, we still need to deliver these services, and we're operationalizing the plans to make that work. So I can tell you from personal experience, I actually have 3 employees who work in other divisions of the county traditionally, who are cross-training to be 911 dispatchers this morning. They're actually in my dispatch center right now, learning how to do basic call taking, so that if we experience a staffing shortfall, we are going to have a group of other people that we could bring in to supplement that resource and continue to deliver that service. That's just one example of how we're implementing solutions to make sure that we continue to deliver these critical services, not knowing what the new world's going to have in store for us. So again, if a stop sign gets knocked down in a car accident, we're going to be able to get a replacement stop sign up. Those critical services are going to continue. The county is going to look different, but we're not shutting down. We're continuing to make sure that those most critical functions that we provide will continue to be provided to our citizens, even with a substantial impact to our staff. So I just really want to highlight that. Some of the things we've done through our emergency operations centers, we've centralized some of our ordering process. Traditionally departments, if they need cleaning supplies, they order cleaning supplies themselves. And they do that through the normal operational budgets. In order to make sure that we are most efficient, knowing that there's shortages of resources, we've centralized that. So now we have our logistics area has an inventory of what we have in a centralized location. We also have an inventory of what's decentralized, still within the divisions. So as we get requests for enhanced cleaning, for a difference in services, we're able to deliver those and understand how that impacts the big picture of what our resources are. And it also makes it a lot smarter. Now we're trying to look for things like bleach. And when we find it, we're able to make a bulk purchase of it so that all the county departments are benefiting from it instead of having to have all the departments trying to scramble independently to find cleaning supplies. So we've centralized that, and that's working well. Our IT staff has done a lot of support for ensuring that those employees who are teleworking are able to do that. This is kind of the new normal for us as we've sent a large portion of our staff to work from home, and we've had to do a lot of just-in-time training for people to learn things like Skype. I'm actually really good at Skype meetings now. So there's pros and cons. No one wanted this situation to happen, but there's solutions that are being implemented, and we're learning from it every day and continuing to improve the effort. Just want to highlight some of the regional things that we are involved in as well. One of the things that is, I'm sure, about to hit the news, if it hasn't been on the news already, is the deployment of alternate care sites. As Lisa talked about, as the conditions, as the cases do eventually spike, there's a probability that we could exceed our capacity within the local hospitals. So each hospital has a plan to be able to upscale their number of patients they can treat and take care of. However, the prediction is that we could exceed what all the local hospital capacity is, and a plan is in place around the metro region as well as around the state to basically set up temporary houses or temporary hospitals. Plans in place. They're looking at a number of sites around the metro. Some have been identified already, and they're looking at sites around the state where additional medical resources get brought in, and those people who are the not as critical patients will be treated at these remote stood-up hospitals. To kind of give you an idea of what those places are, a lot of times they're the kind of primary areas we're looking for are things like dorms or hotels, places that can be easily transitioned but still give people dignity of having their own room. Some states are setting up convention centers and walling things up, and Minnesota's taking the philosophy of if we can provide something that's more comfortable for people, that's what we want to do, instead of doing the mass gatherings within a convention center. Still a possibility, and that was part of the original alternate care site plan. However, we're looking to be a little more personable in Minnesota. Little Minnesota Nice is kicking through here. So that's an active process that's going on. We're actively getting information from our partners in public health. When there is a need, again, we have that centralized logistics now, so we can identify resource management countywide based on that. And thankfully, we haven't had a lot of those requests at this point in time. But as we determine what our obligations are, we've got a process in place to be able to provide those levels of service to the community. And then want to highlight one last thing we've done. We've actually gone through and done some cleaning and done some work with the Regional Training Center to make sure that that facility is available. There's a community group that has some interest in it that we're working with that basically would help save the county some money by using that existing facility and making sure we're getting the best use of that facility. So a lot of different things are going on. I really want to circle back to what I started with. This is a very collaborative effort with involvement all across every division of this county, and employees are stepping up to do what's right to take care of the citizens of the county.
Agreed. Thank you very much.
I think with that, we'd open to questions.
Any questions? Yeah, I would just say, and I know we're going to talk a little bit more about this, but like to see the staff totally jump in and do what needs to get done, it's been pretty awesome. It's been really awesome. You know, no one really asks for something like this or wants something like this, but it's the world we live in certainly now, and a willingness for people to really jump in and do what needs to be done. It's been really impressive, inspiring, and I know we're going to get more into that, but I just wanted to say that. So keep us safe, keep us updated. I know this information changes so fast. Yeah, we want to be transparent and open, and that's what we're doing.
All right.
The good doctor has a...
Thanks, folks. Let me say, it's great for me to have an opportunity to come and review some of the issues we're dealing with also in this, handling this pandemic. Lisa and Scott did some very fine work in presenting the data that we're presently dealing with. Let me say, as we look at it from the point of view of a provider, you know, I do medical direction for EMS, I do medical direction for quite a number of skilled care units, I do medical direction in the public health sector also. So we're looking at this pandemic in different ways from these various facilities I do medical direction for. Let me say, though, that I really do feel quite strongly that once we have a test that gives us an immediate turnaround as far as who has been exposed to this virus and whether or not they're immune to it or not, the better we're going to be able to handle the surge that we're looking to come our way probably within the next 3 weeks. I can tell you that as you see what's happening in these epicenters in our country right now, you're talking New York, New Orleans, LA, that surge will be heading our direction. We're just behind it a couple weeks, 2 or 3 weeks. So we've got opportunities to prepare ourselves for this, and we've talked about this. We have some tests coming up now that will give us immediate info. We have a nasal swab now that people can actually do in their own homes. It gives us a turnaround time of a couple of days. We also have a blood test now that is coming down the pipe, will be available the end of this week, first part of next week. And you can actually take a drop of blood, you put it into a module, and it tells you, number one, if you've been exposed by doing IgM studies, and then if you're immune, an IgG study. And it can tell you if you're immune and you're a healthcare worker, go back to work. Or if you're someone in the restaurant business, or if you're someone doing other community stuff, fine, go back to work, because you're not going to get this thing. That's coming down the pipe, and that's going to give us some really terrific answers. We're also doing, we've got great facilities doing research on treatment. Right now, we do not have antiviral agents, really. There are a bunch of different things we're looking at experimentally. Mayo is heavily into this. There are some other organizations around us that are doing some good research on that. I do think if we have a second wave of this virus hitting us in the fall, which they say may happen, we may have some antiviral agents and so on that will be useful in that setting. And the research is going to show that at this point. The last thing that I would mention to you, Scott had mentioned these alternate care venues. I've been asked by the Department of Health to assist with choosing those sites. So there are three of us, three physicians who are now mobilizing to do this. We're working with the National Guard and the Corps of Army Engineers, and we're going to be traveling around now the state over the next 5 days, 5 to 7 days, to establish these alternate care sites in 8 of our regions, the coalition, which Scott alluded to. So, you know, I'm pretty optimistic that we've got some time to get ready for this thing. The hope is this big surge where you need ventilators and so on that unfortunately New York's dealing with and these other epicenters, hopefully we'll be better prepared to deal with that, if indeed it comes to that, because we've gotten a heads up. And we're working in collaboration. Scott brought that up, Lisa brought that up. It's a very, very big thing. Last thing I'd mention to you, take care of yourself. Follow what Dr. Fauci, National Institute of Health director says we ought to do. Look locally. I think Jan Malcolm, our Commissioner of Health, is doing great work. Our Governor Walz, I think, is following her lead on this. Follow what they suggest. Make yourself safe. Wash your hands. Social distancing is big. Don't hoard. Do not hoard, please. And on top of that then, take care of other people. Be nice to other people around you and assist them with your care, and stay at home. Shelter yourself. If you can do this, it'll prevent this overwhelming need for immediate care that's going to overwhelm our healthcare system. That's what Lisa talked about. You want to flatten out the curve. There are going to be people that get pretty sick from this. I would tell you, though, that over 80% get through it and they do okay. About 15% need a hospital stay and they go home. About 5% end up in an ICU and they're pretty sick. But you know, if you take care of yourself, adequate rest, adequate exercise, good opportunities to interact in a socially distant way, you're going to do okay. So follow the lead of our national leaders who are the experts in this area, and our state leaders who are the experts in this area, and then in our county, our leaders in our county who are watching over us. Listen to what they're saying, because they're following the lead at the state and federal level. We're going to be okay. Okay?
That's a good word, because I was going to ask you, what would be your final word for us and how to follow? And those are all good words. That we
Keep
all
a
need
focus
to.
on those basic things and you're going to be fine.
And just one point of clarification, it is okay to go for a walk.
It's
It is
great.
okay to go out to the park.
Absolutely, Commissioner. Getting outside, exercising appropriately. Now, you know, the social distance thing is good. You got to do that. But you can go out for a walk. You can go out for a bike ride. You can go out and walk your dog. You know, I mean, that's great exercise for you.
Yeah.
Get adequate rest. Eat a well-balanced diet. Take care of yourselves in a way that's appropriate. We're going to be fine.
Yeah.
Okay?
Great, thank you. You alluded to my question, and I think Lisa might have some closing thoughts on it too. Thank you for all that. I like those words, you're gonna be fine. I think everybody needs to to hear that. But from our perspective, are there public health issues that we need to hold on to and make sure we're still dealing with in light of dealing with all this COVID stuff? What are your biggest concerns of what we don't lose sight of, especially in the next couple of months?
Sure.
That all of a sudden we get done with this and we have another crisis on our hands because we weren't keeping watch.
I'll chip in here, and then Lisa, you chip in. You know, I think we had a heads up on this early in the game. We saw what was going on in China. We saw it as it hit Korea. And you know, unfortunately, we didn't move real quick on it. I mean, if you look at the success that they've had in Korea in heading this thing off vigorously and briskly, massive testing, short period of time. They had various pockets of folks that had this illness that they could then isolate and prevent spread. And I think from the point of view of a public health type of setting, we can learn from that. I mean, in the future, if we got a heads up on this from somebody overseas that says we got this bad virus, okay, at the federal level, we got to jump on that. And then that's got to shake down to the state and to our county, you know. I really think in the future we've learned a ton from this, and I think in the future that's a big thing. Also, Scott brought up telecommunication. Huge. I think this is going to open up the door for us in healthcare to use telecommunication in a manner we've never done before. You know, I'm doing virtual clinics now. You know, I have a free clinic this afternoon in our county. It's going to be virtual. It's a virtual clinic. I can refill meds, and I can be accessed by our nursing personnel. If there's a problem, I can take care of it very nicely by a video connect. My EMS folks, I'm dealing with a lot of EMS stuff on this, especially in the rural parts of the state. So what I've done, I've got a huddle system. So every Tuesday night and Friday night through Zoom and my local directors, we connect, for an hour. And they can talk about issues they're dealing with, and it opens up the door for proper approaches and best practices. That's an example. That's a telemedicine hookup. We're going to do more of that. I've done work in the past with community paramedics, community EMTs. And Lisa has suggested, she's got an interest in this also. Think in the future, we're going to use those people in patients' homes, in assisted living, in skilled care units to go there and do testing. They can do the testing, and they're very good at assessment. So they can help me through a telecommunication hookup to evaluate a patient's needs, test appropriately, and we can come up with a plan of care. So you're going to see much more of this in the future through a telemedicine hookup, Skype, Zoom, Uber. There's a bunch of them. Ring Central. All of these are HIPAA compliant, and we can use that venue in the future. Thank you.
Thank you.
Thank you for your question, Commissioner Brecky. Life is continuing. We're still having fires, and just as we're still having fires, we're still having public health issues. We are currently responding to, I had said earlier, a hepatitis A outbreak. If we don't continue that service, we're going to see more hepatitis A. We still have TB. On top of those disease infection responses, the stress that this is providing to our families are going to lead to, and I'm already hearing about it, increase in domestic violence, increase in child protection cases. We have a lot of families living on the edge under stress, and one little thing puts them over the edge. It literally puts them over that cliff. So we're spending a lot of good quality time together at home, and with tensions being high, we are aware that this is likely going to have a surge on some of those other services that we provide. Our family home visiting clients are under a lot of stress as well. We're continuing to call them, to communicate with them using telehealth as much as possible. We're increasing that time a little bit. If they're on like a once every 2 weeks, we're actually doing once a week now, just to double check and check in with them and seeing if they're okay. I anticipate a big, huge surge in our services coming up soon related to those critical needs. So, I don't have good news, sorry.
No, thank you, and I think we all need to be aware of that, and I know you're planning for it, working towards it, your staff are doing all that, but I think it's really good to have out on the table so that everyone can be part of that response, not just the response to this crisis.
I am also concerned about substance use issues related to this, and I haven't checked yet, but if we're seeing more ODs or more use, but I anticipate that that's going to be the fallout of this as well.
Can I ask Mr. Chair, please? So if Dr. Wilcox was talking about this new testing and stuff, if they come out with that stuff and it's mass produced, how soon till we could get back to normal life? Do you think it's still 2 to 4 weeks, or is it 4 to 6 months?
No, you need to come up to the mic or they can't.
Commissioner, that's a good question. I think the reality is it's going to take months for us to get through this issue, this first wave, okay? My gut feeling is telling me that that's probably going to be June to July before we really come out on the other end of this thing in a way that we can positively respond to for future needs, all right? But the big thing right now is we got to get through this upcoming surge. We got to have, because we're going to need healthcare providers to deal with this. We got to keep those healthcare providers safe, and they need proper PPE, and they got to have opportunities so you got other people can take their place as they work these shifts and so on. That's a very big thing if we're going to get through the citizens dealing with these medical issues also. So my big concern right now is I want to make sure that my EMS people have proper PPE. That's that's personal equipment
Protective.
for proper isolation and so on. I need to make sure they got it. I need to make sure that my colleagues have this. And right now, it looks like we got a pretty decent supply, but that's going to disappear real quick once this thing hits us. So we got to have that in reserve. We got to make sure we got a resource for that available and so on. That's a very big area that I'm looking at right now as well. One last thing before I get off the stage here, I want to have a little shout out for our jail. Let me say we have, I do medical direction there and I do patient care there. We have some really fine screens in place. Number one, to determine who may enter the jail and who may not, which is terrific. We've also cut way back on the number of folks in the jail right now related to offenses that perhaps are not in a need of incarceration right now. And also our folks there who have comorbidities, significant diabetes, COPD, cardiac issues, mental health stuff. Those are the people that really get hit hard by this virus. Same way with our older folks. We're trying to keep those people out of that jail system right now. Also, commendable to our sheriff and my people working over there, my nursing staff and so on. They're doing some very fine things there.
Commissioner Wolf, just to add to your question, until we have a vaccine, life won't be completely back to normal, in my opinion. And vaccine is 12 to 18 months out, we're told. But what the testing will allow us to do is we'll know if you have antibodies, you can go back to work. We'll know who is positive and who isn't. And that will enable us to not have a broad sweeping shelter in place where everybody has to be home, because right now we don't know who is and who isn't. So that will at least lift some restrictions and get some semblance of normalcy, at least going back to work. But until we have a vaccine that's available to everybody, that's when we'll be able to get back to normal. Thank you for your time.
Thank you.
Yeah, we've got questions that could go on for days, but just thank you for your update. Thank you for your input. I think the good doctor had a good word, just be gracious to one another. Absolutely. And we will prevail, we will. It's gonna be bumpy. I personally, in some weird way, have an unbelievable peace that surpasses all understanding throughout this process. Doesn't mean I'm not gonna get sick, doesn't mean I'm not gonna, I don't know, but partly that's because we've got great staff working on this. So thank you for doing that and putting your best foot forward for the people of this county, state, country, and the world. So thank you for that. All right, we're gonna move on to another item. I'm looking out into the hallway because we're trying to keep our numbers in this room to the under 10. We're going to go on to item number 5.2 and receive information on HR 6201, the Families Coronavirus Response Act. And Lori has done her pacing and is ready to be
That's right. This one.
before us, so thank you for that.
Thank you. Thanks, Tracy. Good morning, Mr. Chair and Commissioners. I'm Lori Huss, and I am the Employee Relations Director, and I am here today to present to you some information on some new federal paid leave mandates that are coming out. Before I jump into that, I do want to acknowledge as well some of the comments being made by others that have presented this morning about just that spirit of Scott that's really flowing through the organization right now, through all employees, really being creative and trying to do things to really continue with the services in a time that's unknown for all of us. And so I just want to say thank you as well to our employees for those extra efforts and for those that are going to continue. So as we jump into this legislation, what this is this was an act that was signed by President Trump on 3/18, so March 18th, so not that long ago. And what it's going to do is it's a law to assist employees that are directly affected by the COVID-19 with job protection and paid leave in two areas. One is under the Emergency Family Medical Leave Act. It's an expansion of that act to identify and to work with families with child care issues. And then the second area is going to be emergency paid sick leave, which is a new provision. Both of these leaves are effective tomorrow, April 1st, and they will go through December 31st of 2020 as it's currently been written. So the required county action, I'm here informationally because what we're going to need to do is put in a policy to cover these two new provisions. And this will be technically an amendment to our leave of absence policy, but we're going to set it up on the side under our emergency declaration because it is specific to COVID-19 and it is time limited. So that's how we have envisioned it, and that's how we're going to be doing it to meet the letter of the law. So the Scott County policy will be amended and effective as of the 1st as law complies, or as law requires. And then the section will be standalone because it will go away with the sunsetting of 12/31, again, as it's written. And what I'm presenting to you is based on information as of yesterday because this also is a fluid situation. We are getting updates from the Department of Labor continually related to guidance and interpretation of this new law and the regs. It only was 4 days between the time it was passed in the House and was signed by the President, so there just wasn't a lot of background that typically comes along with bills like this. So let's look first at the expansion of the family medical leave. What this is going to do now, it's going to grant 12 weeks of job protected leave to employees to care for their children because either one, the school or place of care has been closed, or two, their regular child care provider is unavailable due to the public health emergency. This is the first employer paid FMLA provision that's been enacted, and all employees would be eligible for this following 30 days of employment. How this is going to work then is, again, it's under EFMLA. It's going to be considered EFMLA. FMLA covers 12 weeks. So this provision too will cover 12 weeks. And how it'll work is the first 10 days, or 2 weeks of the leave, is going to be unpaid under the provision. And then employees during that time, those unpaid time, may use emergency paid sick leave, which I'll talk about in a minute, or they can substitute other accrued leave during the unpaid time. For then weeks 3 through 12 of the leave, employees would be paid at 2/3 of their regular rate of pay for the hours worked, and part-timers would be prorated for their hours worked. Pay under this provision does not exceed $200 a day or $10,000 for the time frame of the weeks 3 through 12. And we will be working with employees through request form. They'll need to request this leave from Employee Relations, and then we will work with them on getting the provisions of the leave set up for them. The next provision then is that emergency paid sick leave. So this is entirely new. It requires employers to provide employees up to 80 hours of paid sick leave, again, prorated for part-time staff. And employees are eligible for this if they are unable to work or telework because of the COVID-19. And this one is cut up under 6 categories. So I'm going to go over those and explain how pay works under those. So for the first 3 categories, it's really designed around employees who are ill themselves. So in category 1, the employee is subject to the federal, state, or local quarantine or isolation. In category 2, an employee has been advised by a healthcare provider that they have to self-quarantine due to concerns they may have. And number 3, the employee is experiencing symptoms of COVID-19 and is seeking a medical diagnosis. For those 3 events and/or situations, then the pay will be full pay for up to 80 hours. So 2 weeks of full pay under this new emergency paid sick leave program. It maximizes at $511 a day or $5,110 in total for the 2-week period. Categories 4 through 6, then, that moves into employees who are giving care to others. So for category number 4, those are employees who are caring for individuals who, from the previous slide, were either quarantined by a state federal or local official, or who were determined to need self-isolation by a healthcare provider. So that's what number 4 is. They're caring for individuals having those situations. Number 5 ties directly back to the EFMLA provision. This is employees, again, caring for children whose school or place of care are closed or the provider's not available. This is where they would be covered potentially for those first 2 weeks or 10 days of unpaid leave under the EFMLA provision. They would be paid for it here under this number 5 category under the paid sick leave time. So and then the category 6 is a catch-all and is not being used at this point, but it has been set aside in case there are needs that need to be recognized under this, and we would then recognize those conditions as well, but none exist as of the time I'm speaking to here. So pay for staff members who would fall through categories 4 through 6 are going to be at 2/3 of their regular rate of pay. Again, that's going to be prorated for part-time employees. And the maximum for the provision here is $200 a day or $2,000 in total. Some additional details with the paid sick leave is this one is available immediately, so effective tomorrow, people can apply and be eligible for this emergency paid sick leave. This is in addition to, so it's on top of and can be used before any other paid leaves that employees may have accrued at this point. There's no carryover for this benefit beyond 12/31. And again, employees will need to work with employee relations through our benefits department and use forms that we're going to have to help track and sort through all of this. So in closing, the Families First, it was federally enacted, and it's really to help support and help employees who are impacted directly by COVID-19. It was fast-moving, so as I said, the Department of Labor is still providing interpretation to employers, and we're going to react and make changes as those interpretations come out, because we do depend on those. The Department of Labor has initiated a grace period between the 1st and April 17th to allow HR departments to enact their systems and their processes to get it in place. Any action then would be retroed to 4/1 for anyone who is eligible as of 4/1. And as I said earlier, we'll make amendments and as the guidance comes out. So with that, I can stand for questions.
Thank you.
Mr. Chair, Lori, thank you. I think a lot of our businesses, our county's businesses have been looking closely at this act too.
Yeah.
Do you have any ideas or thoughts about the immediate impact, especially, I assume, for employees who might be out under that number 5 or choose to take this leave under number 5? How are we preparing for that?
Well, that's part of all of the work across in the EOC is trying to anticipate where we may have areas where we will be hit with staff members not being able to be here, and do we have backup plans? So it's really employee relations working with administration as well as the EOC to try and look at that. I do think we're going to have a number of people who could be eligible under multiple of these categories, both the sick as well as the mainly in the caring for others, but also the child care. So as soon as those leaves start coming in, we'll be working closely to make sure we have all of our services covered.
Thank you.
All right. Thank you very much.
Thank you.
Appreciate the information and keep us updated as you get guidance from DC and above. Well, I
We'll
guess
do
not
that.
above, but thank you very much. Appreciate that.
We all need guidance from.
True. Well, yes. Thank you for catching me on that. Right. 5.3, adopt resolution number 2020-053, approving the operational service plans for county operations during the COVID-19 pandemic. And Leslie is going to present.
You're gonna have to give me a minute to get to.
Sure. Unless you got something.
Looks like something fun.
I know. I was
We're
gonna say
take
maybe a
dance
little,
break?
yeah, a little levity maybe in the midst.
We will have a little levity.
Oh, good.
Just some creative staff.
I
I
can't get to this because.
Seen some of those videos floating around out there, impromptu videos.
Just, there we go.
If you guys saw that flash on the screen, says what happens right before the best employee quits.
This
It actually says, you know,
I've read that article, yeah.
but what is,
It just talks about employee management and kind of being able to foresee.
what's the biggest tell?
I don't remember. They had a list of like.
Just if anybody, for the 17 viewers at home, we are still keeping our under 10
Yep.
in this room. Not that you can see it, but
We're at,
Down to 6.
So the Word
Making
documents
everybody-
are.
staging them out
And
outside,
then-
coming in, switching
Yep,
as the topics change.
and then the YouTube.
I'm glad we
videos
did
also
this
there
meeting
under
because-
Internet Explorer, I think.
Oh,
I don't think we can
oh,
shut down and
No.
hide for the rest of our lives.
Yeah,
That's my
no.
opinion. I understand that,
yep.
Well, good morning, Commissioners. I'm here to talk about a couple items, and I'm going to do them in one presentation. But first off, I wanted to echo a little bit. I guess we all have that common theme. The message of patience that we've had in our staff and being patient, because sometimes it seems like things are changing hourly, and our messages from close this day, open this day. Nope, the DMV just said nope, Department of Ed just said close the library, when the day before they wanted us to keep them open. So our staff has been really, really good. I cannot emphasize that enough. And I try to walk through the building at least once or twice a week for those that are here for those needed purposes, and just their smiles and energy that they're still here to serve the public, Skyping in with people, or I've learned how to Zoom now with people, and seeing that they still have an incredible desire to serve and meet the public need. One of our child protection workers had to go out on a small infant case, and being able to go through that and do it, and seeing the pride she had still with what we're dealing with to be able to take care of these kids, it's just impactful. The other thing I want to say is the partnership between the sheriff and the county attorney, I would say, is just unprecedented when I sit in these meetings. And the working together and the collaboration that Scott talked about, I don't hear that in other places. And that all three areas, that the ones that work under the county board, the folks working for the attorney, the folks working for the sheriff, all working together and supporting one another. I can't thank Ron and Luke enough that I can call them up, and in an instance notice, we're having a conversation on some pretty important things. And so just want to really thank them as well as we've been working through this. So I'm here today to talk about adopting Resolution 2020-053, which is approving these operational service plans for our county operations during this COVID-19 pandemic. And then also adopting Resolution 2020-054, which is authorizing the continued closure of our building through at least May 3rd due to the COVID-19 pandemic. And so as most folks know, and I think it's already been hit on, Governor Walz issued that Executive Order 2020 on 3/25. And he really identified and called out some specific, as he called them, essential services. They're listed here. They're very standard ones that you would see in COOP planning and things like that. But he also talked about other work performed for governmental functions, which are to ensure the health, safety, and welfare of the public, to provide essential elements of our financial system, and continue priority services as determined by you, a political subdivision of the state. And all political subdivisions of the state will determine the minimum personnel necessary to maintain these governmental operations. And when we took that 2 weeks and closed the building until April 1st, this is really what your division directors, managers, and staff have been working on, is to identify in a couple different ways. One, the critical systems that we have to keep going if it's all hands on deck. And then as well as how do we continue to provide these other services that we're used to providing the public in a different way. We as well has learned there are different ways to provide services, potentially even moving forward, that might be more efficient for your staff and for the public than waiting in lines. So as part of this, we have prepared a few more than I was hoping, 59 operational service plans. These were prepared by the divisions. They really identify the services that we are going to continue to provide, And it really is meeting kind of that executive order of you identifying the folks that need to continue working and what services we're going to continue to provide. These have been reviewed by risk management from a risk perspective. Are we making sure we have the right PPE? Are we making sure we're social distancing? Employee relations reviewed them from a contractual standpoint. Finance took a look at, were there any additional costs to this? The attorney reviewed them from a legality standpoint. The division directors have now reviewed them, and I also, over the weekend, read all 59 plans. All employees will either receive a paper or all employees will receive either a digital or a paper copy, and they will be reviewed with their supervisor, so they kind of know.
Martians are dropping in.
This is Earth.
Must be New Mexico.
Submarine.
By Roswell.
I think he's in New Mexico.
Little interlude there.
Good, all right. They'll be reviewed with their supervisor, so they understand those safety precautions, what they need to meet through this kind of revised service, and then understanding if they have questions or get in a situation to make sure that's elevated to their supervisor or manager so that we can keep both them and the public safe moving forward. In a lot of cases, they have a limited face-to-face contact. Some of these have been waived by the Department of Human Services and other areas. They've identified other options to be able to do this through email, through voicemail, through Zooming, through Skyping. It calls out personal protective gear. We go through a procedure. Employee Relations and Cheryl and Rhonda have done a great job in preparing a document that we should be asking clients if we do have to have a face-to-face. And then what are some of those operational needs, from wipes to masks if it's a life-death type situation and we have to respond. And then what are the services we're truly providing? They've identified some of those priorities, and they've actually stopped providing some like group type situations and things like that until they can come up with a way to Skype or Zoom those types of group meetings. Let's see here, I think I have to hit escape. Just gonna give you an example. This is what will go out on the website if people really wanted to take a look at it and are being shared with staff. But this is a service plan for library. So this really identifies their function A would be access to library materials, 24/7, how they can get an online card, which is a change, how they can get additional copies of ebooks. The physical resource, we're gonna for the first time have curbside pickup. And so they'll be able to request material through the catalog or a mobile app or through a phone call. They will then be able to drive up. We will actually ask them to pop their trunk or whatever it is. We would set them in there. There would be no interaction. They would be able to take those books and work with their kids or adult books, whatever it is. So we'll be able to continue. You can see it's rolling out in 2 of them on the 1st and the rest of them a week from Monday. They will be promoted on social media, the website, newsletters. There will be gloves then for when materials come back, and we'll either quarantine it for 72 hours if we can't wipe it down, but if we can get enough disinfectant and washes, we would then be able to turn those materials around quicker. The outreach programs, these are the types of things that we will continue to offer virtually. They'll be promoted again in multiple ways, but early literacy classes, which you're going to get to see an example here, I think, that might make you smile, and the creativity of some of our staff. The public access Wi-Fi, you will note down below the county administrator said we cannot do this because we are closed right now by the Department of Ed. People could come out to access it outside of our building if they could social distance, because it does reach outside the borders. But the access to public PCs, we can't do until the Department of Ed allows us to open that up. But even under social distancing, they were going to move some of those into conference rooms so we would be able to space the computers out so people could have access to them. Information services, we can still do versus phone and email and answer questions. And of course, then the meeting rooms right now are not available because we don't want large congregations. You will see then a level of staffing changes and resource. So what do they need for access for each one of these areas from a logistics request? And then finally, you'll see here that I noted until the libraries are opened up, we can't do that, but we will make the curbside available for folks. So that's just one example coming out of the library area. One other example I think I have, which is much more complex, which would get into child protection, just to give you an example. But here's their guidance for their central intake. All maltreatment reports will be made virtually. How they will be doing screening. They will ask some of these questions, been tested. They then would get into some of their investigations and assessments. So kid safety, it is still at the top of our list. And if we need to respond, they will be seen with the timelines and doing the investigations. But it goes through here. If a parent would deny for COVID-19, you know, again, we might have to work with the county attorney's office, providing some of the CDC guidelines, raising initial contact guidelines. And you can see the face-to-face mandates and exceptions. Again, fever, cough, they would go through those questions. If it's yes, they would then have to figure out how we conduct that home-to-home, keeping everybody safe, following the preferred PPE gear. Here's the approved technology for client contact. There's only certain ones that are secure. So right now it's Skype, WebEx, and Doxy.me. But we are actually vetting and looking at other ones through IT that might be possible. FaceTime could be used for foster parents with parents, since that would be more accessible on those types of occasions. Again, how they're going to document to make sure that we are complying. Guidance for related to ongoing case management. If we are required, where there's a current safety concern, again, they go through those questions. And then the PP&E. If maybe we don't have to do a face-to-face because we feel the safety is secured, here's how they can do it versus Skype and WebEx. And here again is that case prioritization when face-to-face should happen. You can see this one gets pretty detailed in what staff are need to know and how they're going to follow through. And again, as we get through that, then what is it they need for equipment? What is it they need for cleaning materials and PP&E? And then the strategic branch would have been the attorney the attorney ER, risk management, and the finance asking some specific questions and then making sure that they follow through on that. Again, all of these will be reviewed with the manager, with their staff, so everybody knows and we don't have questions about what they can do and not do. Those will also be posted. Whoops, I think I just did that backwards. Those will also be posted on the website for the public if they are interested in seeing that as well. Besides those service plans, every division going into this prepared a continuity of operations plan. And that really identified the minimal amount of people that it took to operate in each one of these critical services. Your leadership then went in through and identified, and Scott rattled some of those off earlier, but really identified those 16 critical things. 911, right? We have to answer those phones. We have people cross-training today. We have to keep the jail open. We appear there to have enough coverage and would be able to pull folks in. The JAF, the Juvenile Alternative Facility, that has to go. They've limited the numbers, and we're only taking from Carver and Scott County right now, but that is an area where we're going to need to do some cross-training. They would be at risk for having issues if we lose some staff. So we have identified those services. You're seeing them on your daily incident report. The attorney's office has to respond to certain court cases, right? We have to respond to child protection. We have to respond to adult protection. So those critical things, right now we continue to be green, but we have identified areas that could be at risk with absenteeism, and we're beginning to cross-train in those areas. In fact, you've already seen some jail pictures of folks helping over there because one of our contractors can't keep enough staff. And then we will monitor in the ability to be able to provide and try to support those areas. The second thing that we're asking you to take action on today is the closing the building effective through 5/3. And this really is consistent and trying to provide some consistency for our residents and our staff who have been working in this world. Are we open? Are we not open? It is consistent with the federal social distancing that the president talked about yesterday through 4:30, not having groups of over 10, staying apart. The governor's stay home Minnesota is until 4:10, but he made it very clear he will reevaluate that on 4:10. But he also, at that time, the schools are remote to 5:4, and the restaurants and bars, the social areas are closed till 5:1. And so it's our recommendation that the buildings remain closed through 5:3, very clearly with the ability for you to revisit that based on state and federal actions that might take place before that time period. So with that, I wanted to, before you discuss and take action, wanted to just give you one example. Tracy, where is it? Oh, there it is. Of some of the creativity of your library staff, just because it made us all smile. They actually...
Hi kids, it's Lulu here for pajama story time. Nobody can go to bed without a good bedtime story. So put on your comfy jammies, grab your favorite teddy, and snuggle in tight. It's pajama story time. It's pajama story time. This is our bedtime rhyme.
That gives you an example, but then the kids actually
Read by Lulu. Gerald was a tall giraffe.
will
His
have
neck
a
was
series
long
where
and
they'll read
slim,
books with
but
the
his knees
kids. So
were
this will
awfully
be one of
crooked,
our
and his
online
legs
story
were rather
times
thin.
that we're
He was very good
putting
at
out there
standing
for
still and much
families and kids to give them that story time that is so popular in our community, and a way for them to access that. So a little fun on this day as well.
So whose fault is it if that little ditty's running through my head all day?
Mine.
Okay. Just wanted to, accountability and all.
So with that, I'd be happy to try to answer any questions, or we would ask for your approval of those two resolutions at this time.
All right.
Thank you, Mr. Chair. Just, Leslie, could you clarify for us, right now, are all county employees working on something, somewhere? We haven't laid off county employees.
Mr. Chairman, Commissioner Brecky, that is correct. Right now, we have everybody working. Several customer service staff are over in the jail. Several staff are over training in dispatch. When I spoke with Jake in libraries right now, he is able, just seeing how this curbside book goes and the online things that they're putting out, all of the library staff are working. We will have a request, though, that we need some cross-training in the JAF, and so that is an area that we've identified. So some of those folks, we might have to be even short in some of those areas to make sure we're cross-trained and ready to go there. I think probably the biggest question right now is the intermittent staff, that, those services potentially in the library we're going to have to take a look at. There's some areas in administrative support where there's a couple areas that your strategic planning team has flagged as we have one person and maybe two are trained, that maybe if Ron or Highway or Cindy's area had some support, we might want to even cross-train some of those admin staff to make sure we could backfill if somebody went out. It's a little risky. But right now, yes, everybody is working and doing their jobs as directed.
Great, thank you.
I would just say, I have a couple questions. You were deputy administrator here for how long?
Oh my gosh.
And this is not this is your life, but just a little.
11 years, 10 or 11 years.
And you've been administrator for how long? I forget exactly. I know, kind of.
It's been a long 15 months, I think.
Yeah, I was gonna say it's about a year and a half, going on 20. And was one of your things when we were doing the whole interviewing or whatever you want to call it, one of your main objectives was to come in and allow the people in this organization to spread their wings and flourish, to rise to the occasion, to live out their calling in whatever position they happen to be. And I have seen that. I've seen that. I've seen people that have been here a while flourish. I've seen people that are new flourish in their roles. And I just can't help but think for such a time as this. I mean, no one ever wants something like this, but how many plans do we have here? 59?
Yes.
And so, you know, I popped my head into that one meeting. We all kind of walked through the halls doing different things and seeing our friends and neighbors, which are the county employees, getting it done. And I'm going to say in large part, that goes to the environment that you've created to allow people to rise to the challenge. And here we are. We're being challenged. And I know, I'm stopping you because I see what you're going to try to say something. And you're a person, in my opinion, that doesn't care about getting credit, but cares about people. And I wonder if that, adding another C, has to do, you were a catcher, right? Leading from behind the plate. I have a girl in softball, so I you know, boys in baseball, I get the whole deal. So I just wanted to say thank you for that, and our whole staff. I mean, but I just felt it important to say that publicly. I say it privately, I think, to some extent, but it's important to say publicly that you're getting it done, our folks are getting it done, and we're learning a lot on this thing on the fly and adapting and changing. Like, I've never, in almost 52 years of life, had something come and change and ebb and flow and, okay, here's the information, here's the data, oh, scratch that one, but I just got it. No, but it's changed. And so we're having to ebb and flow and change and adapt with that, times 59.
Yeah, Mr. Chairman, I would agree with that. You know, you think about most COOP plans or emergency responses. You know, I've been in government 35 years, right, in May, and been through tornadoes. I've been through floods. We lived H1N1 and how to get inoculations out to school kids. And it's usually there's an incident and you respond. This one has been responding to plans, to changing how you do work and having to do it very quickly. And so you are exactly right. Your leadership team, when you take a look at some of those folks that you're going to have around here for the next 10 to 12 years, those young leaders, the Jen Schultzes, the Tony Winnickeys, the Steve Jones, the Daniel Foxes, the Barb Dolls, they have just done, and I can't think of all the names, I'm just crediting, Scott Haas, they have just done a tremendous amount of work, and their creativity, the rollout that will come for GIS for attendance, that will feed their system for when an area is going red or green to be able to know that, we better make sure we've got people planned for backup here because we're seeing them at the brink of red because of absenteeism. It is going to be tremendous, and that will roll out here by the end of the week. But that coordination, that ability, I mean, Jeannie Anderson and I are talking about your next item on a Saturday at 5 o'clock in the afternoon, making sure we get it right. Support again from the attorney and the sheriff. All through this organization, those senior leaders have been together, they have worked together, crossing those divisions. They've done a lot of work.
Well, and you always find out what's inside when you're squeezed. And you hope you never get squeezed, but life tells us you will have troubles, but be of good cheer. And so I feel like that is where we're at. So this isn't a time, you know, I'm not trying to blow smoke, but it's just like, I think it needs to be said that our departments are working together. We've got 59 plans here, and I did have a question, and you sort of answered it, but these are plans that they're designed to be comprehensive, but also nimble because things are changing. So this isn't your typical government bureaucracy. Well, the plan says I must do that. No, we're working here. This works best. Let's make that change.
And these plans are set up. You will see as you read through some of them, or the public does, that if it goes from a stay home Minnesota till, okay, we're back to social distancing and we need to, this is how they're going to respond. So that is in there as well in most of those areas. And you can see that, like the one for HHS, that was set up for, if we go back to more face-to-face though, we still need to follow these procedures and protocols. The library was set up, if we come back now to PC public access, this is what we'll do to set appointments and social distance. So yes, they've taken into account the stay home Minnesota, as well as if it relaxes some and we're back to social distancing, how are we going to operate?
Yeah, because it is changing fast. And part of the theme of today has been, I think Scott mentioned it, I mean, everyone sort of mentioned it, that we're learning new things, we're trying new technologies, we're things that might actually change for the future. So in the heat of the battle, we got to get things done. I mean, there's certain things that we just have to do, but are we also, I mean, I know the answer to this, but I want to ask it. Are we also keeping notes and whatever you want to say, like, wow, this would work in the future? I mean, unfortunately, we learned it in not the way we would like, but this works, and we need to keep, you know, each department is keeping tabs of that so that when, I'm going to use air quotes, normal life returns, because it's probably likely going to be different. But they're like taking that into account, and we didn't lose it in the storm. That we're like, wow, let's implement some of this.
So Scott Haas has a extensive list of what's gone well and what hasn't gone so well that we'll be looking at when we debrief after all of this. But I think you will hear, I was on the 3rd floor, and Dr. Raditz in the Mental Health Center, they always have kind of a, I don't know if it's every other week group meeting, and they're always my favorite ones to go in and just stop into. And they were all online, and you could see them Zooming and Skyping or whatever they were doing in, and to be able to talk and see them. But when you talk, you heard Dr. Wilcox say telemedicine can work. I think we're learning some of these things can work. I read one of the things in one of the plans yesterday for some of the meetings where we have to drive extensively in and out of the county. They have found that some of these telephone or Zooming has saved them time, and they've been able to communicate with people maybe twice a week instead of just once a week. And so I think staff are learning some things. Now, some of these are mandatory that are just waived, but there might be some things that come out of this that communicating in different ways more frequently might actually be better for us in some ways. So I think we are noting those things and capturing them to be able to talk about as we move forward.
Very good.
And on that line, not that people don't have enough to do, but I think there's a lot of learning just from physical structure too. You know, no matter what happens, I bet we'll never have computers at the library right next to each other anymore. You know, even our lines at customer service, are we going to think about different ways to do that with our new building? If there's any adjustments to be made right away because of the things we're learning, I assume
I
that's
think
happening
that you
too.
might see passports go to appointment. Why do we have to have 7 families standing there during that versus call and set an appointment and we'll get you through? I think there's some appointment onlys coming out of this that will benefit multiple businesses, units, and make our time more efficient and the public's time more efficient.
Well, and that's just in our own little county, right? I mean, I know you're tied in with all the, at least metro administrators and maybe beyond, but you know, what I keep thinking of, I think as Scott talked about 911, like we do not want that going down. So we're cross-training, you know, I mean, that is a lifeline, literally. But hey, there's a 911 right across that county line, and oh, there's a 911 right across that county line of having that kind of redundancy and staff built in for times like this, not about turf, not about ego, but about the people. And I know that's part of your conversation, things like that.
You know, it's interesting because if you go back to your strategic plan, several of these, dispatch, cross-training with other communities, emergency management response and training for all of our staff and the board, this just hit us a little bit before, but you had several of those as priorities for us to be working on over the next 2 years. And we're working on them now through the fire. But yeah, I think it has identified that we need some redundancy in those critical systems across county borders.
Maybe a little more openness to have those conversations by those that need to have them. But
Mr. Chair, I am so glad to hear a silver lining to some things here after all the
exactly,
gray
we're
gloom and
digging.
doom
We're digging.
from
We're gonna
the
find
media.
them. We're
And
finding
with
them.
that, I will make the motion to adopt resolution number 2020-053, approving the operational service plans for county operations during the COVID-19 pandemic.
And are we gonna do this are we passing?
Two different.
Yep, okay, separate motions. All right. So we have a motion, we have a second.
Discussion.
And any discussion on item 5.3, adopt resolution 2020-053? I'm just looking over to the phone. Any other discussion? Otherwise, Tracy, if you would please, give us a roll call.
Sure, Commissioner Weckman-Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
Aye.
Commissioner Beer,
Aye.
Commissioner Ulrich.
Thank you very much. Now we have another
Mr. Chair, I will also motion to adopt resolution number 2020-055 authorizing entering into an agreement with Access Networks, or, whoops, excuse me.
Yep, there we go.
2020-054 authorizing the continued closure of county buildings to public access until at least May 3rd, 2020 due to the COVID-19 pandemic. Sorry about that.
Second.
We have a motion and a second. Any discussion?
This is the times we're living in.
Yep, it is. It is. Our hearing none. Looking to Tracy to give us a roll call on that.
Sure. Commissioner
Resolution?
Weckman-Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
Aye.
Commissioner Beer,
Aye.
and Commissioner Ulrich.
Resolution passes. Thank you very much. Now we're going to move to item number 5.5 to adopt resolution number 2020-055, authorizing entering into an agreement with Access Networks, Inc. to construct equipment on existing towers. I think, all right, Cindy, you're going to take us through?
Good morning, Mr. Chair, members of the
morning.
board. You know, this crisis timeframe with COVID-19 and the need for people to social distance and to work from home and to educate from home and to be really informed from home really brings us into a little bit of a whirlwind within our community as we're looking for, have we provided the correct infrastructure that allows these folks to do those functions? You know, we generally do this in a more strategic manner, and we talk about how we're going to roll different types of services out. And back in the day, a couple years ago, we entered into a contract with Access Networks to actually help us move some things forward, and they provide a lot of feet on the ground for our fiber networks and some of our connectivity issues. With this COVID-19 crisis and with the order from the governor to stay home, to truly just stay home, we've come across, of course, and we've heard from some of our residents, some of our schools, some of our townships we have some issues here in our townships where there is limited availability of internet. Either there is none, or that the areas that some of the services they're just so underserved that they really can't do their jobs from home. The kids can't educate from home. And even just connectivity for the families at home being informed has been difficult. Over the course of the last probably 2 to 3 weeks, I've heard from some of you on maybe some comments that you've heard from the public. We've been contacting our schools. They've been handing out hotspots as they can to try to get their kids to be able to educate from home. Most of those schools opened up this week. We have some that'll be opening up next week. But regardless of where they're at, what's our role in trying to bring services to those that are unserved or underserved? With this crisis, generally this takes a long time to try to figure out how we're going to get services to these underserved or unserved areas of the county. So, but because our schools and because are in school now and they're needing to e-learn, and because our people who have been working and crossing or driving to and from work are now at home, we're getting those needs escalated within our county borders, and we're like, how do we get services to them as fast as we can? So we've been talking to Access Network, we've been talking to our townships, and we're hearing the urgency. We're talking to our schools and hearing the urgency. And over the course of the last probably week and a half, we've really fast-tracked and found a way to get services to these unserved or underserved areas of the county within 3 to 5 weeks. Something that would generally have taken probably 3 to 6 months. We know we got to get feet on the ground. So with this, we have, talking with Access Networks, they're also a provider of services, but we have a contract today with them to say, hey, we need this to be done. You're the people on the street. How can you make this happen? They've been communicating with some of the townships saying, okay, we have 3 areas that we know for certain that are either unserved or underserved. There's an area of Louisville that has service to them, but it is extremely weak. We've heard from folks say, I can't do anything from home. How are my kids supposed to learn? How am I supposed to conduct my business? So with that, we know that we need to provide some level of increased broadband services to that area. Another one of our areas is more of on the east side of 35W in the Newmarket Township area where there's no service. There's a provider out there, but for the last 3 to 4 years, they've been kind of just dragging their feet and not really providing that. Well, now these people who have no internet are saying, hello, we still are part of your county. How come you're not doing anything? And then lastly, there's another area right along Burgess Avenue in Spring Lake Township where, again, there's a little bit of a scattered type of an internet service. It's not strong enough for anybody to do anything worthwhile. If you do get connected to work, you probably get kicked off. As the kids are in their e-learning classes, they're losing connection. So what do we as county have some, in my mind, responsibility that if we can get them service, we need to help do that. In consult with the townships, after talking with them a little bit, and I'm really relying on Access to continue the conversation with those townships, is how can we partner? It's their residents, it's their kids as well as our residents and our kids. It's our kids and it's our residents. And so in consult with them, we talked about maybe a 3-way agreement. Each of us will take 1/3 of the cost. That way it's not so overly onerous for any of us. Access already has a contract with us on the Jackson Tower. And so we don't have to go through a lot of rigmarole with that one. In addition, they already have a partnership with Crown Towers, both out in Newmarket Township and in Spring Lake Township. So we know that those are already buttoned up, which is the reason that we can escalate this and get this service to these areas faster than we normally would have otherwise. Talking with you and talking with some of our key leadership here, we felt that maybe a 1/3 split was a doable venture. Now, this is an unfunded request. It's $105,000 per tower, so it's nothing just to blink about and say, it's petty cash, because it isn't petty cash. It's a lot of money, and for the county, if all 3 of these go through, and if all the 3 townships also decide that they want this to go forward, we're looking at a total outlay of $105,000 for all 3 towers. As we look at the cost benefit to these areas, we know that what Access Network is saying that they can do is that they could deliver these services within 3 to 5 weeks. So we want them to consider that. We want them to have a plan to get that done, and they're working on that today. We need them to already have the permits in place, which they say they have. They have that partnership with those, or that agreement in place, so they don't have to work through all the mechanics of that. They have infrastructure already in place so that they can easily connect these and get that service up to those areas that are unserved or underserved. In addition, they're going to be able to provide the direct broadband services right to the homes, which in many cases, maybe someone can construct the towers, but then we're still pounding on the door of the provider to say, get out there and try to get these people, let these people know that if they need services, they're going to be available for them. They're going to guarantee the service levels that exceed the FCC's recommended guidelines of 25 up and 3 down for internet speed, up and down loads. And finally, one of the things I heard from you and the things that we talked about too with the provider is, so what's going to be your rate structure? We want to make sure that if you're going to provide this, like many other internet providers have done, is they've said, hey, I just got actually an email from mine, and they said, we just increased your up speed by 15 megs or Mbps, and it's no cost to you. So good for me. It came into my internet, or in my I text on my phone, and we too wanted to make sure that this provider will do something same and similar. They're going to offer a 50% reduction in installation, and then a $30 rate reduction for these people coming on per month. So they know that they're going to get really great speed, really great service for something that's going to be a fraction of what they would have paid otherwise. With the ability for us to fast track this, what we're looking for is for this board to approve this agenda item, and let's try to get access to these areas that really need it so our businesses continue to operate home, kids can continue to learn, and our residents can continue to be informed given this COVID-19 pandemic that we haven't seen the peak. We don't know where we're going to be in the next month, 2 months, 3 months, but at least if we can get our folks connected, that's what we're looking to do. With me in the audience today is Perry Mulcrone, who is our fiber manager, and Steve from Access Network. So if you have the technical questions, you picked the wrong person to provide this update to you. If you have any of those, I will certainly ask them to come up and respond.
Thank you, Mr. Chair. Thank you, Cindy. I've had a lot of conversations with all kinds of different individuals about this in the last 2 weeks. I just would like to publicly clarify a couple of things, just because there's some misunderstanding sometimes about the county's role in this type of work. We're not saying that broadband and internet is a public good that we're guaranteeing to everyone or that we're paying for. I think it's important to note that this is just helping get infrastructure into areas of the county that don't have that infrastructure. Then the provider would be providing, residents would still pay for their service based on the market around there and the market to get those services. So I just think that's really important to publicly state, because some may look at this like, oh, we're giving free internet to some citizens and not others. We're really helping getting infrastructure in place. Secondly, it's so true, Cindy, I know you were shaking your head, so that's true, right?
That is correct.
Thank you. Secondly, I think some people could look at this situation and say, oh, why are we just helping those little pockets here and there? And at least my understanding is, and this happened with good people way before I was in this chair, we've worked hard over years and made financial investments as a county in this infrastructure throughout the county. So this isn't new or unusual. We've already made those investments in other areas, and these are areas that just haven't gotten served by that investment yet. And then third, I do feel like even though we are doing this on kind of a fast track emergency basis, let's get it done, which is great. It's nice to get something done quickly for once. I feel like this really fits into our strategies of economic development. Our role as a county in economic development isn't necessarily giving, I keep thinking of bad words for us, incentives, there we go, incentives for private businesses, things like that. Instead, we said we'd rather invest in infrastructure that allows private business to come and succeed in our county. And so I feel like even though this is kind of a fast, let's get it done new thing, it fits right in with our strategies. So with that, and hopefully to get more discussion on the table, I'll move to adopt resolution number 2020-055, authorizing entering into an agreement with Access Networks Incorporated to construct equipment on existing towers.
And I will second that with some discussion. And just to echo what you said and to piggyback it, you know, I look at some of this stuff, and I've taken numerous calls on this for not just the last couple of weeks. This has been years of whatever, and it's just kind of come to a head because now people are at home and there's so many people sucking this up, this internet. I look at it a little bit as like electricity nowadays, this internet stuff, you know, people have to have it just about. And so whether they, whenever we do it, if we're doing it now, that's a great thing, because then these people have this stuff forever for the future. These areas will have ability to grow economically, and I think it's a good thing. You know, and everybody's got a little bit of skin in the game on this, so I think it's a great thing. So thank you.
Yeah, I just, the same is true. I mean, if this was, I feel like I'm using air quotes a lot today, but if this was normal days and times, this likely wouldn't come through like this in such a way. Maybe it would, maybe it wouldn't, likely wouldn't. But we find ourselves in interesting situations, and in my own personal life, like I hate spending money. But if I find something that makes sense, I'm semi-happy to do it. And that's my own life. And this just kind of made sense, the timing, the things that were going on, the split, that it does further the infrastructure for bigger and better things as a county, that it's not, you know, playing favorites, and it's just part of a plan that's already been in place, as you alluded to, and it's building out that plan in just a different format and a different fashion. So I do have a couple of questions. I just wanted to reiterate, because the big thing for me was, yes, the split, because I think it makes sense to have skin in the game, but the timeline, the 3 to 5 weeks, is that, I mean, for me, that's kind of a big deal, is the expediency of getting this equipment installed, as opposed to hoping. I know one of them sounded like it was really quick, and I'm just looking around. I don't know if we need...
Mr. Chair, I think that I would actually ask Steve Herman to come up from Access Network, because they're the ones who are going to be installing, and they know the readiness of that equipment getting placed on those towers. I think one of the things that we have to wait for is we have to make sure that these townships also agree.
Sure, yep,
Right.
So
yep,
we have,
absolutely.
we have a township meeting that's coming up on Thursday. We have one coming up next week, and I think one the week following. So, given those priorities and those meetings, if Township A says, we're ready to go, we've approved, that they would start working with Access right away. But, Steve, I would ask you to come up, and you can speak to a little bit about the readiness from your perspective on getting this done.
Well, Steve's coming up, and I thank you for saying that, Cindy. I want to reiterate that no township has committed yet, so we're just putting this in place in case a township does. That's really going to be up to them if this project goes forward in their township.
Nor are we forcing
No.
anything on anybody. We're just trying to
Thank you.
do our due diligence
To do whatever they want.
to have our part done,
Yeah.
and hey,
Yeah.
so yeah.
Exactly. Thank you.
No,
Mr. Commissioner,
not forcing.
thank you for your time. Can everyone hear me okay?
Yes.
All right, perfect. Yeah, so these are tasks we've been working on. Obviously, things have been expedited a little bit, but a lot of these structures have been in place. We've spoke with the county on the county's asset we're looking at using. The other tower agreements have been in place, so we're prepared for this. As far as timelines, they're going to be the 3-week timeline for the first tower will be from approval from the township, right? So we're kind of hindering on that a little bit. We are scheduled with this week and next week to be at the township boards or communicate with them with whatever arena that is, whether it's phone call, in person. From the townships I've spoke to, they do have questions, but they are in support because we have been engaged with those townships, for the last 2 years since we took over the contract, because these have always been issues.
Yeah.
And we have made a substantial financial investment into this to deliver service. The adoption has been a little bit slow for us, so that's why we're looking for participation in public-private partnership to make sure we can get to that where we need to be. But these are the communities with the most need right now, based on the survey data we have. We have a lot of requests in those areas, and that's just talking before this crisis happened. So we know there's a need there today, and obviously the need has grown. So those are gonna be the highest priorities for areas. So the timelines from 3 weeks for the first tower, 4 for the second, 5 for the third tower. Those are from approval from the townships. So I'll open it up if there's any other questions.
No, I guess the only other, I was looking in my notes here, the subscription, since it is public-private, and I'm not trying to infer that you wouldn't do this, because I think it's written in here, but you're gonna have some generous subscriptions available to the folks that would
Correct.
use this.
Yep, so Cindy spoke to, we're discounting our installation by 50%. So it's down to $149 for the installation fee, and then it's $59 a month with a router, $49 without a router. So we do provide a managed router as well. So we did some survey data across the county a while back, and that is actually below the standard throughout the state for internet access fees. And we're offering a last mile solution that's a dedicated circuit for each individual. So it's a really good solution. There's adequate bandwidth there. As partnership with the county, what we got in return for managing the contract is we got capacity in your same fiber network. So we have a 10 gig connection that comes out of 511 on redundant paths, and we're just delivering off that 10 gig backbone these last 1 mile, 2 mile, up to 7 mile connections. So the internet, they're right out to the public internet. It's a very good technology.
Which maybe we just clarify a little bit that it is extending our existing infrastructure. Because the fiber is carrying that signal to those antennas and out your equipment.
Correct.
So it's just a continuation of building out, which we've been doing for years and years and years, of that infrastructure. So those are my 2 questions.
Just one more clarification. I think Cindy mentioned that in at least some of these pockets, there may be another provider, but obviously not necessarily having the same strength or product. Obviously, citizens will still have provider choice where there's more than one provider.
Correct.
Just wanted to make sure that that's clear and everybody understands we're not taking anything out, we're actually offering more choice.
Right, I think our obligation is to make service available, whether people choose to go with one or the other.
Exactly.
But we just want to make sure those areas are serviced. And everybody wins if there's even a multiple provider situation, because people should have options.
Yes.
Because we've seen it in other communities too, where somebody has control of it and they really take advantage of that.
All right, we have a motion and a second. Is there any further discussion as I speak over towards the phone?
Cindy's.
No question.
Otherwise, okay.
I just have one other thing that I'd like to say, so if anybody's listening to this, they hear. Those people who are in areas where there's service, but they just, for some reason, either their connection isn't good, or maybe they don't have service and they're not really entirely certain who is servicing that area. Perry has been working with those folks and really just kind of being that in-between, just as a good county employee to say, hey, I can be the liaison, I'll get you hooked up and ready to go. So those people that say, hey, how come not me? They can easily contact either us or he has a list of providers that can get them the service that they need in their areas.
Good clarification.
Thank you.
Okay, Trace.
All right. Commissioner Weckman-Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
Aye.
Commissioner Beer,
Aye.
Commissioner Ulrich.
Aye.
Resolution passes. Thank you very much. Now on to 5.6, an item to postpone a public hearing set for April 7th, 2020 at 9:15 a.m. to consider adoption of the Scott County Public Health Nuisance Ordinance number 31.
Mr. Chairman and Commissioners, we thought we shouldn't probably hold a public hearing next week when the building's closed. And so since we had already advertised it before all of this had really gotten underway, we're asking you to postpone this, and we will bring it back at a time when the building is open and it's appropriate for a public hearing.
I will
Chairman,
make,
this is Beard. I'll make that motion.
second.
We have a motion and a second. Any discussion? Otherwise, I'll look to Tracy for a roll call vote again, please.
Commissioner Weckman-Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
Aye.
Commissioner Beer,
Aye.
and Commissioner Ulrich.
Aye.
Motion carries. Thank you very much. Now we are going to move on to item number 6, committee reports and commissioner updates. I'm going to look down to my right. Commissioner Weckman-Brecky, please.
Yeah, thank you. It's been since our last board meeting, I think we've all been on different calls and webinars and things almost every day, either from NACO, AMC, the White House. I haven't actually kept track of all those calls. It's been almost every day. I did look at my calendar just to see that since our last meeting, I've had 2 actual virtual meetings. On March 26th was the Together We Can Steering Committee meeting. We had a meeting working on plans for that committee and those efforts, especially in light of our different environment now. And then on March 20th, actually that was before March 26th, had a call for the SHAC group and the statewide health group. So both of those calls happened. Otherwise, it's been, I want to say, a conference call or meeting 1 or 2 times a day since then. And then talking with citizens, providers on this broadband project has been very frequent over the last 2 weeks also. And I would just like to echo the chair's comments about Leslie and the leadership team here. It's been amazing for them to watch. And I think in one communication with the chair this week, I said, I'm just trying to sit on my hands and close my mouth because there's much smarter, more competent people than me running things. And we're really fortunate to have that in a time of crisis.
Totally agree. Thank you for that. So true. Looking down to my left, Commissioner Wolf.
Thank you, Mr. Chair. I had just, same as Commissioner Brecky, a lot of things canceled or postponed, a lot of Skype meetings, a lot of phone meetings. A couple of them I mentioned is the Metropolitan Mosquito Control on the 25th, on the 26th, Vermilion River Joint Powers, and also that evening, Elko New Market. And I'll also just echo, I've been in contact with a lot of my townships, the couple cities, and I've been tossing down all the information, whether it's from Leslie or the state or the White House, whoever, and they appreciate all that information. And talking to Leslie almost every single day on stuff here, just appreciate, because I know they're working their butts off here. So I just want to mention one of the couple things here. The road projects are still pretty much on in this county. They're working outside. They're going to get stuff done here, and there's not a lot of traffic here. And maybe another good byproduct is, with some of this internet, provide more internet, less people be on the roads here. And maybe we won't need as many roads at some point here. So that may not be the worst thing on earth, but they are going to get the road projects done, and hopefully quickly, more quickly than they thought, because there's really not a lot of traffic. So That's my report. Thank you.
Thank you very much. How about Commissioner Beard? Are you with us there? I know he is.
I am. I did a Skype meeting yesterday with the Transportation Alliance Board. When I'm with you next week in person, I'll give you a little more updates. Other than phone calls, emails, and text messages, no, I have nothing new to report.
Thank you very much. Commissioner Ulrich.
Yes, just one actual call-in meeting to report was the TAB. They voted to extend the solicitation period by just 1 month, which was very disappointing. We were asking for a much longer extension of getting the solicitation requirements in, and they went with a 1 month to be reviewed monthly. So we were on the very short side of a vote to have it extended much longer, but that's the end of my report.
All right, thank you very much. My report is very similar. You look at the calendar, there's a lot of red dates and headings on there that were canceled, but many phone calls, many conference calls and the like, and just really good. I mean, you're finding out who we're dealing with, the people that we have to come in contact with or get to come in contact with. That's probably a bad phrase to use these days, but 6 feet apart, but on the phone, and the hearts of people and their passions coming out. In some weird way, it's the best part of the job. You just hate to have to do it in situations like this. But good people, lots of contact, but not in person. So that is my report. Looking down on my left, Leslie, anything?
Mr. Chairman, just one thing. We do have a board meeting next Tuesday, which we will be holding, and you brought up road construction. When I had looked at the agenda preparing for our agenda review today, quite a few of them are approving some road projects, which are good things because people, it's one of the things the governor kept open was building construction, residential construction, road construction. People can social distance, they can keep at work, so that's a good thing. You'll see several of those moving forward. Other than that, the board meeting will be pretty transactional, those types, and we'll have an update again on the COVID-19.
Can I just ask, so we'll do the same type of setup here, and we may have 1 or 2 more board members here, so.
If, you know, we haven't said everybody has to go virtual. You haven't given us that direction at this point, so we're setting it up anticipating several of you would be here. If 1 more of them or 2 more of them come, we will have to think about how we spread you out or move in front. But at this point, the 3-2 actually seems to be working quite well.
Yeah, and we're not trying to make any statement one way or the other how we're doing it. We're just kind of rolling with what we've been given, what you know, leadership from a staff level coming in and out of the building. So yeah, we're not, but we're here and getting it done. So looking down on my right, County Attorney.
We do not have to recess. I'd just like to do a shout out to Jeannie Anderson from my office.
Yeah.
She's been the point person from my office with Leslie and the leadership team, handling the legal stuff, the civil stuff from my office. So she's been critical to myself as county attorney, as part of the leadership team with Leslie. So Jeannie Anderson's a superstar. Just wanted to fight that out. And my part has been, like Barb said, is stay out of her way. So, but we do not need to meet.
Yeah, that's good news, and I agree. I mean, you know, some names are mentioned today of, you know, of us being thankful. It's a this takes a team. It takes a team, and maybe the name didn't get mentioned, but by and large, most of the people that I come across the county don't care about credit. They're fulfilling a calling by living their life in the public sector, and it's awesome. So hats off, and thank you for your flexibility because things do change. From the citizens, we appreciate your patience because you're in this together and we're your friends and neighbors here at the county. But also to that note, there's a lot of good going on too. There's a lot of good. Humanity is really showing itself. But we also need to remember, both from a staff perspective and our folks in the county, that we're all dealing with this at very different levels. And so I just pray that we would treat each other well with grace and dignity, especially as allergy season comes and we all start sneezing a little bit more and having running out. But I mean, literally that could happen, that we would just treat each other well. With that,
Can I just ask, Mr. Chair.
Yes,
Ron,
absolutely.
so, you guys are you doing much court trials and things like that?
Not a ton, we're beholden to, the
Okay, sure.
the court system. So they've pretty much almost canceled everything except for speedy child demands. We're trying to take care of domestics, the more serious felonies, and in speedy child demands, we're still not at the point of ignoring people's constitutional rights.
Oh, right, yeah.
So some stuff has to be dealt with. Obviously, the serious felonies, we're still booking people into the jails. I don't want people to think that we're opening the doors to the jail and everybody's getting out. That's not the situation. People are still being booked into the jail that need to be held. So public safety is still our main concern, and we are still doing our job. I have staff in my office every day, lawyers to handle the limited court cases. I have all of my attorneys have remote work capability, so we rotate in and out as far as who needs to be in the office, who does not need to be in the office. We're doing the same to some extent with support staff. But yeah, no, we are open and doing business.
Okay.
That's a good word.
Motion to adjourn.
We have a motion.
Second.
We have a second. Always look down to the phone for any discussion. Otherwise, I'm looking to Tracy.
All right, Commissioner Weckman-Brecky,
Aye.
Commissioner Wolf,
Aye.
Commissioner Beard,
All right.
Commissioner Beer,
Aye.
and Commissioner Ulrich.
Aye.
We are adjourned. Thank you.